For 2024, as a first step towards providing for the well-being of Nigerians, we passed the appropriation bill into an act now, and it is expected that it will be implemented. Because this government is a new government, I've tried to be a little modest about the situation on ground. Otherwise, generally, we're confronted as a nation with a myriad of challenges, myriad of problems. No less the problem of insecurity. As Nigerians say, and as observers have seen, our security problems have continued to multiply. Then it was Boko Haram. Today, it is banditry. Today, it is kidnapping and abduction, especially of school children. Today, armed robbery has reared its head. And generally, there is a scary, pervasive feeling of Nigerians that things are getting worse and worse and worse. Not to talk more of the level of poverty in the land now. I can tell you that more than 70% of Nigerians are on the poverty line. And today, inflation is on the rise, close to 30%. And what about unemployment? Before we begin to talk about infrastructural deficits. So if you name it, whatever is problem is present in Nigeria today. And so Nigerians are hurting. So I believe that the Senate will ensure through its oversight functions that this budget is religiously implemented. That is the first step. Because all the problems that you have here now constitute the genesis, the foundation, which is bad governance. And so if we can ensure good governance through the religious application of the provisions of the Appropriation Act, then we would have gone halfway in solving Nigeria's problems. But unfortunately, quite unfortunately, we're hearing stories about our endemic problem of corruption associated with several ministries and several ministers. If these allegations are proven, then we have a huge challenge on our hands here. Because this is supposed to be a corrective government, a government that is anchored on hope for the ordinary person. Have you ever seen a rich man begging? It's only the poor man that begs. And I do not see how a rich man, for instance, will take up arms against his state. It's only the poor who, one way or the other, try to ventilate their predicament through violence. As Minister of Interior, I was the chairman of the Senate White Paper Writing Committee, looking at the Northeast crisis. Then it was just insurgency and Boko Haram. And we made far-reaching recommendations in the white paper, adopting the recommendations of the panel that investigated the root causes of the crisis. And right at the bottom of it was this issue of poverty. Right at the bottom of it was the attitude of Nigerians to our state. And we wrote a comprehensive white paper, including but not limited to the need for a holistic security approach to the situation on ground. And we recommended that, look, as soldiers and security forces were moving against the insurgents, liberating some communities and local governments, there was need for holding forces so that as they are moving to Sambisa, the insurgents do not take the other way, the back door, to come back to reoccupy areas that have been liberated. It was not implemented. As a member of the 9th Senate, I was a member of the committee that was set up, ad hoc committee that was set up to review the security architecture of Nigeria with a view to plugging all the loopholes that has made the decimation of insurgents and criminals impossible. We did a comprehensive work, made far-reaching recommendations. And in this 10th Senate, I had the opportunity of telling my colleagues that these recommendations have never been used. So right now, you cannot sleep in Abuja with your two eyes closed. These criminals, they have access to everybody. They walk into your house, they walk into your, they track you down on the road and pick you up. And one of the dangerous elements in attending to the insecurity that we have in this country that we're doing is the payment of ransom, negotiation with kidnappers. It's never done anywhere in the world. I have not seen and read about any precedents. And today you find that kidnappers will demand, say, 50 million. So if you are lucky enough to have friends and men of goodwill to quickly raise the 50 million, they say, hey, it must be somewhere there. There must be plenty money else. And they will raise the bar. So it is an accepted international best practice that you don't negotiate with terrorists, you don't negotiate with criminals. Because of the consequences, because such negotiations and such payment of ransom emboldens them and re-equips them towards carrying further actions. And so I think that we must, as leaders, we must, as a country, develop the necessary political will to tackle these problems headlong. We cannot be talking about the same problem day in, day out, week in, week out, month and year. I mean, it doesn't really make sense. It makes us a laughing stock. Today we're talking about bad roads. Next year we're going to be talking about bad roads. Today we're talking about dilapidated school structures. Tomorrow we are going to talk about the same problem. Today we are talking about lack of drinking water for the ordinary person in Nigeria. Tomorrow we are going to talk about the same thing. For how long shall we take the patience of the electorate of Nigerians for granted? Yes, the National Assembly has a responsibility, a cardinal responsibility of oversighting the ministries. But I'm sorry to say that we will not be able to effectively carry out such oversight functions as to stamp out some of the malfeasances that we're talking about here. A very, very unfortunate development. And so it becomes virtually impossible for senators and members of the House of Rep to delve into the very basics of projects. Especially when you discover that sometimes some of these policies are so technically crafted that you can hardly find it on the surface. Starting from the building of bill of quantities to scope of work to what should be done or can be done. And so sometimes most of these things are so shrouded in secrecy that you go to the office, you ask to be taken around, sometimes they don't take you around, sometimes they take you around, they show you only those things that you want to see. Today, most of our primary health care system, centers are in very sorry states of disrepair. For me, I undertook that I was going to build a standard healthcare center of international standard in every of my local governments. I have built 5. I'm building additional 4 in this 2024 budget to complete it. And my next attention will be drawn to the equipment in terms of physical facilities and drugs in these health centers. Attached with each health center is an ambulance. Or at least let my people in every local government have at least one standard health care center with movable diagnostic machines embedded. At least let them have one in a local government that they can run to. And considering the problem of management of such systems, I've also intended, while handing over these hospitals to the communities, to ask for private partnership. Run it for the people. private-public partnership. Since I'm handing them over to the local government officials in collaboration with private sector participants will take over the running of the clinics. That way, it is my hope that there will be efficiency and the clinics or centers will be effective. That is what I have undertaken to do. And I will urge other senators and members of the National Assembly to also take similar steps. If we do, the combination of all these efforts certainly will give our people some level of effective healthcare delivery system. But that does not take away the role of the state and central government to provide healthcare facilities for our people. If you go to virtually every local government, each of the 774 local governments, our general hospitals are in serious state of decay. In my constituency project arrangement for 2024, I have allocated, for instance, the general hospital in Oju local government, 200 million naira. I have also allocated one borehole for that hospital. Because looking at the hospital, from the reports that I get, that hospital is less than a consulting hospital. Because there's no doctor, there are no facilities, there are no nurses, there are no medical officers and the rest of them. And so I'm trying to, in addition to a healthcare center that I have built in Adeno, in that same Oju local government, I'm trying to rehabilitate that hospital to combine effectively with that health center to give our people a proper healthcare delivery system. I want the state government to do the same. Most of these general hospitals, if not all, are state government hospitals. But like I said, all of them, in all local governments, including my local government, are in very serious state of disrepair. So I will encourage Mr. President to intervene in virtually every aspect of our lives now, especially in our economy. Look at the free fall of the naira. It's ridiculous. At least I was old enough to know about the cedis, about the CFAs. Some of these currencies are now stronger than the Nigerian currency. Where did we get this wrong? And Nigerians want to see visible attempts at reversing this trend. Otherwise, we are in trouble, especially those of us in government. We're definitely in trouble.